Welcome back to the DRH show. I'm delighted to have someone in the field of cardiology and medical technology. He's not only a cardiologist at White Plains Hospital, but also serves as the Senior Vice President of Medical Affairs at Hello Heart. Trained at Columbia and New York Presbyterian, his expertise in managing the interplay between heart health and mental well-being is unparalleled. With a passionate commitment to preventive healthcare, he has been at the forefront of incorporating innovative technology to assist patients in improving their heart health across diverse demographics. His approach has significantly influenced the field, making profound impact on patient outcomes. Dr. Edo Paz, thanks for joining us today.
Good morning. Thanks for having me.
Okay. Dr. Edo Paz, just give us a quick background, your trajectory in life, and how you ended up doing what you're doing.
Yeah, so my name is Edo Paz. I'm a cardiologist. I did my medical training, as you mentioned, at New York Presbyterian Hospital, Columbia University Medical Center in New York. I'm board certified in internal medicine and cardiology. But I've always been very interested in health technologies and how they can improve the care we deliver to patients. So although I do practice part-time at White Plains Hospital in a very traditional cardiology job, I also lead medical affairs at Hello Heart, which is a digital therapeutic that helps members to control their cardiovascular risk factors and improve their heart health.
Now, let's talk more about that. Let's talk about depression and heart health. Is there a bidirectional relationship with them, and how does they affect each other?
So you're exactly right. There's a bidirectional relationship, meaning mental health disorders can contribute to heart disease, and heart disease can contribute to mental health disorders. So let's go into that for a minute. So on the mental health side, people with chronic anxiety, depression, or even stress, they can have increased level of stress hormones, which can raise your blood pressure and your heart rate. And over time, that can do damage to the heart muscle. There's also some evidence that people with those behavioral health disorders have increased inflammation, which can lead to buildup of plaque inside of your arteries. And they can even have a higher likelihood of having a clotting event. Those are all the physiologic or body-driven mechanisms, but we also have behavioral mechanisms that can drive heart disease. So people with behavioral disorders or stress might lead to unhealthy coping mechanisms like smoking cigarettes, eating unhealthy foods, lack of exercise. So it's very clear that those disorders can contribute to cardiovascular disease or heart disease. Now, in terms of the other direction, people who have had a heart event like a heart attack or a new diagnosis of congestive heart failure, they can also develop disorders of anxiety, depression, or stress because of fear, pain, a lack of certainty about the future, even financial stress from being hospitalized. All of those can contribute to a feeling of depressed mood or actual diagnosis of depression or anxiety. There's also one other important connection, and that's in medications. Many of the medications that we use for mental health disorders can lead people to gain weight. They can predispose to diabetes. They can even increase the risk of heart attack, stroke, and other conditions. Similarly, a lot of the medications that I, as a cardiologist, use can lead to decreased energy or depressed mood. So as you can see, there really is an important relationship between these two groups of conditions.
And what do you think? Because you've come across a number of patients, obviously, because you're a cardiologist. So what are the common symptoms of depression that you observe in your patients who have experienced heart attack? And why would you say that this is notably prevalent among survivors of heart attacks?
Yeah, so when someone has a heart attack, it really can be a profound stressor in their life. As I mentioned earlier, they might be fearful of the future. They might lose confidence in their ability to do the things they did before. They might feel guilt because of maybe behaviors that have contributed to the heart event, or guilt about the impact of their diagnosis on family members. And this can really contribute to depressed mood, sadness, lack of energy, difficulty concentrating, lack of motivation, no longer enjoying the things that they used to enjoy before. Those are really all the textbook definitions of major depressive disorder.
And what would you say from your professional experience, what are the effective ways to manage stress and depression to prevent heart disease? Because, as you've discussed earlier, they have a bidirectional relationship.
Yeah, so I'll start by saying that, being stressed and even feeling down once in a while is normal. That's a normal part of life. But if you have those symptoms more often than not, and for long periods of times, it's a good idea to talk to your doctor, because there's lots of different things that you can do, whether it's therapy, medications, or other. But there's also things you can do at home. So, for example, finding an activity where you can really be mindful, just being present and thinking about your thoughts, and things like meditation, or even being out in nature. Another great example is exercise. Exercise is great both for your mental well-being as well as for your cardiovascular disease risk. And then the last thing which I'll mention is community. People who are depressed or stressed, or someone who's had a heart attack, it's better if they have a network to lean into for support. And finding a community, whether it's a family member, friends, loved ones, a church group, a sports team, it's a great way for people to develop some support, and it can help with all of the conditions we've been discussing so far.
So that's the mental health side. What about the mental health? What about the physical aspect? Can you share some straightforward strategies for enhancing heart health and potentially preventing heart disease? You mentioned exercise earlier, but what other strategies can you share to us?
I think the first step when it comes to heart disease and preventing heart disease is to understand your risk. Mm-hmm. So before you can really talk about strategies for fixing things, you need to get a state of the union, understand where you're at. So I think things like getting a blood pressure screening with your doctor, or checking your blood pressure at home, getting your cholesterol screened, understanding your family history, that would really give you a good sense on an individual level. What's your risk for developing a heart disease event? And what should you do to address that event? As you mentioned, exercise is a double, killing two birds with one stone. It's great for your mental health. It's also great for your heart and cardiovascular disease risk. Eating healthy, getting plenty of sleep. These are all things that I think we understand are good for us, but sometimes it can be hard to prioritize them. And I think really focusing on making it a priority is a great strategy for people to decrease their risk of having a heart disease event.
Now, let's talk about Hello Heart. You're the Senior Vice President of Medical Affairs at Hello Heart. So how does Hello Heart help users in improving their heart health?
Yeah, I think Hello Heart is a digital technology that is there with the patients every day to help them stick to those habits, which we were just discussing, but can be hard to stick to. So what that means is members have a smartphone application, and they have a Bluetooth connected blood pressure monitor. And through that, there's a couple of core features. Number one is the ability to track heart health related metrics like blood pressure, heart rate, cholesterol, activity, medications. Within that is understanding. So a blood pressure of 135, is that good or bad? What about an LDL of 140? Same question. But the core feature of Hello Heart is digital coaching. Those are tips around diet, exercise, medication adherence that are based on the standard guidelines from premier societies like the CDC or the American Heart Association, but we deliver it to members in a very unique way. It's highly personalized, it's highly actionable, it's driven by AI. It allows members to make accomplishments and build on those accomplishments. So I like to think about it when I'm a physician and I send a patient home after a heart attack, they have a very long to-do list, right? They may be taking 4 or 5 new medications. I may be instructing them to do cardiac rehab, to start exercising more, to change their diet, to lose weight. Oh, and by the way, you should come back in 2 weeks for some blood testing and a repeat blood pressure. That to-do list is very, very hard for a member, and it can actually be demotivating, especially someone who's had a heart attack and might be overwhelmed by that to-do list. So what Hello Heart does is it helps members to break down that care plan into actionable bits that they can build on slowly. You can also generate reports and send those back to your provider so that the provider understands how you're tracking on your progress. Because we always have our smartphones, right? More than 85% of Americans have a smartphone. Let's use it for good. So this is a technology that really helps members to stick to those diet, exercise, lifestyle tips that we know that they should be doing, and also reminds them to take medications and sends them back to their doctor when things are off balance.
Absolutely. And of course, like what you've said, we're almost like Android now, like technology is already kind of infused with us. But what role does technology play in heart health management? Because earlier we were talking about depression and how it's related to heart disease. But how does people with depression help is being helped by heart health? Hello Heart, sorry.
I think it's tremendous. I mean, we know that someone who's had a heart attack and is
Mhm.
depressed, that person is less likely to recover from the heart attack than someone who doesn't have depression. And that's tied to a lot of things: not taking medications as prescribed, not following healthy lifestyle habits. And Hello Heart is a great tool for those people because it takes that to-do list, which can be really long and overwhelming, and it really helps them to break it down. And that would be my tip for someone who's dealing with a feeling of being overwhelmed. It's just like if you have a massive project to do at work, it can be very overwhelming. But if you break it down into smaller, actionable, and achievable bits, and then you achieve those little bits, you can build on your success. So a great example that we do on Hello Heart, we have this concept called dot to dot. So if a member is tracking their activity, you can track your activity through Apple Health and Google Fit on the platform. If, let's say, a member is walking more and we see that in his or her activity, and at the same time their blood pressure goes down, we celebrate that success. We say, hey, John, you've been walking more in the last month and your blood pressure has gone down. Keep it up. Or if a member starts a new medication and we see that his or her blood pressure went down, we say, hey, John, you started lisinopril 3 weeks ago and your blood pressure has gone down. Congratulations. But by showing them that what they're doing is actually having an impact, they can really build on that. They can be motivated to build on it even more. And that's a great way to take something that really seems unattainable because it's so big and break it down into smaller and actionable activities.
Now, let's talk about demographics, because obviously you're trying to accommodate different demographics when it comes to race and obviously gender. How does Hello Heart accommodate those different needs?
Yeah, it's a great question. So, any member who is on Hello Heart will have an individualized experience. That's because the more you provide to Hello Heart is going to reflect that back to you. So, for example, if you are a woman who's of age greater than 60, and we know that there's a good chance that you've gone through menopause, we're going to float information to you in a non-judgmental, non-stigmatized fashion, educating you on the fact that menopause can contribute to heart disease risk. This is something we know from, again, those professional societies like the American Heart Association, but we don't do a good enough job. But it's even more personalized than that. I gave you the example of the dot to dot, where if your activity goes up and we see that reflected in your blood pressure going down, that's personalized just for you. It's a calculation that only applies to you. If, for example, you read a piece of digital coaching that you find helpful and you rate it helpful, the app is going to float more of those tips to you because we know that you're going to respond well to it. Aside from designing the app in a way that we think is going to close health equity gaps, we also make a point of studying health equity gaps. So, one of the things which we haven't discussed so far is that we do a lot of research at Hello Heart to try to demonstrate that Hello Heart is effective. And we've published big studies in the Journal of the American Medical Association. We just had another paper accepted in a large journal showing that members on Hello Heart lower their blood pressure, lower their cholesterol, and lose weight in a very significant fashion. But we've also looked at different health equity factors to see if Hello Heart is equitable against those. And the answer is yes, meaning it doesn't matter if you're a man or a woman, young or old, black or white, whether you live in a city or in a rural environment, the outcomes that you have on Hello Heart are exactly the same. This is research that we presented at the American Heart Association meeting 2 years in a row. So we not only design the app in a way that we think is going to be helpful, equitable, we also study it to ensure that it actually is equitable, which is something that we find is a really important benefit of digital health technologies.
So, Dr. Paz, I just want to pivot the conversation back to depression. So, could you talk about the barriers to care that patients with depression face after heart attack? And of course, can you suggest some ways to overcome these barriers?
Yeah, I mean, there's a lot of barriers. As I said earlier,
Mhm.
people who are recovering from a heart attack and have depression are less likely to recover from that heart attack. And that's a really big deal. And some of the things that contribute to that, again, there's fear, there's lack of confidence, there's guilt, there's a feeling of being overwhelmed, there's depressed mood, lack of energy, lack of concentration, all of the typical the symptoms of depression. And what something like Hello Heart can do is, again, to break those tasks down and make it more achievable so members can gain on their success. But even outside of Hello Heart, again, I think the key is making small victories. You don't need to run a marathon tomorrow. I tell my patients that you don't need to run a marathon tomorrow. Why don't you try just walking 10 minutes today and try doing that 5 days this week? And next week, let's go up to 15 minutes. And when you break it down into an action that's much more achievable, that's the approach we take at Hello Heart too. We see that members are more able to accomplish that. I also think that trying to set up some healthy routines. So a great example, people who have had a heart attack, they may be on 5, 6 medications, 2 blood thinners, a cholesterol medication, a couple of blood pressure meds. This is a lot to handle, and it can be very overwhelming for patients. Even just the feeling that I'm now a sick person, this idea that you now have a chronic diagnosis. So some of the tips that I give members is buy a pill box. Just get a pill box, set it up right by your toothbrush. And when you see that pill box every morning, that'll be your tip. And the way we've addressed that at Hello Heart is we've created a medication tracking feature with gamified features. So if you take your meds for 3 days in a row or 4 days in a row, we're going to celebrate that success. And again, that's how you build healthy habits and keep building on those to really accomplish great things like weight loss, lowering your blood pressure, lowering your cholesterol, and at the end of the day, decreasing your risk of having another heart event.
Absolutely. And that's something that I can really relate with because I've been diagnosed as pre-diabetic. So I can't just, overnight give up all my sugars and donuts. I'm very irresistible to give up. So I just, take it in small steps. So that's really an important thing to consider. Now, Dr. Paz, considering that May is Mental Health Awareness Month, what crucial message would you like to convey about the link between mental health and heart health? I think you've already covered this earlier, but some things that some of the audience should really know about.
So heart disease is the #1 most common chronic disease in America, and it's been like that for decades. It's very, very common. However, a lot of our diseases are considered silent killers. It's a very scary word, but the idea there is that you may not realize you have high blood pressure because you don't necessarily have symptoms of high blood pressure. And in fact, you may only discover that you have high blood pressure or high cholesterol after you've had a cardiac event. Mental health disorders, on the other hand, we do feel symptoms of those. People do feel depressed. People do lack interest. They feel anxious. They feel stressed. So while they're kind of different in the way people experience them, there is a very close link between the two. We spent a few minutes at the beginning talking about this bidirectional relationship, and one can really impact the other. So what I would suggest is, #1, understand your risk. On the heart side, that means getting a blood pressure check, getting your cholesterol checked, talking to your doctor about your family history, any other conditions like prediabetes that might increase your risk. On the mental health side, that might be being aware of symptoms. Again, it's okay to be stressed once in a while or feel down once in a while. That's normal. But if you're feeling those symptoms more often than not for long periods of time, that's not normal, and that's something that you can get help with. Once you understand your risk of these two conditions, there's really a lot to do. We understand very well how to treat high blood pressure and high cholesterol. There are dozens of medications for high blood pressure. Nearly all of them are generic and they're very inexpensive. So even if you have side effects or you don't respond well to one, there's another one we can reach for. We understand very well the diet, exercise, and lifestyle habits that you can do to improve your blood pressure or improve your mood. But unfortunately, we're just not doing a very good job in this country of doing that. There's around 120 million people in America with high blood pressure. Only about a quarter of them are under good control. So I guess what I would say is understand that these are two important groups of diagnoses. They do have important connections, and there's really a lot that can be done for each. Speak to your doctor, get on a program, maybe it's Hello Heart, maybe it's something else, to really start to take steps on a day-by-day basis, because you really do make so many decisions on a daily basis that can really impact your heart risk and your behavioral health, your mental health, your mood, that there's really a lot that can be done for all of these conditions.
Absolutely. Now, Dr. Paz, what future developments or innovation in heart health that excite you the most or do you think will have the most substantial impact?
There's a lot of activity in the heart health space right now. There's a new class of medications. I'm sure you guys have all read about them that have been used for weight loss. It turns out they're going to have some profound impact on heart diagnoses, like the risk of having a heart attack or a stroke or even congestive heart failure. There's new technologies, new ways to do procedures that used to be very invasive and now are much less invasive. But for me, it's all about the things that we understand how to do. Like I said, we know how to treat high blood pressure. We're just not doing a very good job treating it. And I think that using technology to improve those things is really promising. Just to give you an example, we're talking a lot about heart health and anxiety, depression, stress. So on the Hello Heart app, a member can take an anxiety screener because we understand that anxiety and stress can really contribute to high blood pressure and heart disease risk. And then once you're on the Hello Heart app, you can do these activities that are geared towards stress reduction, mindfulness, meditation, obviously exercise, diet, that might have a benefit for your anxiety. And it turns out that doing those activities help. So we actually presented research at an American Heart Association meeting last year showing that people who start off with severe anxiety, the majority of those people on Hello Heart reduce their anxiety. But I think the thing that was most interesting is that the more those people reduced their blood pressure, the more their anxiety scores went down. And what I take that to mean is that those same activities that we're doing to focus on heart health, diet, exercise, healthy living, those can have a profound impact on your mood and on your stress levels. And even just getting in control of your heart disease risk factors like high blood pressure, even just that concept of being more in control can also improve your anxiety, depressed mood, or stress symptoms.
Okay, Dr. Paz, I've prepared 2 questions for us to have a better understanding of your approach as a cardiologist. So first is, how has your training and experience at Columbia and New York Presbyterian shaped your approach to cardiology and patient care?
When you do your training, both in internal medicine and in cardiology, you tend to deal with very complicated and hospitalized patients. The intensive care unit or the cardiac care unit at Columbia is as sick as that unit in any hospital in the country. We get extremely sick patients who are really just fighting for life. And I think the way that has really made me focus on prevention, and it may seem confusing, but it's much better to prevent one of those events than to try to bring someone back from the brink. In my day-to-day practice as a cardiologist, I'm not taking care of people who are clinging for their life on a day-to-day basis. Infrequently, of course, when they're hospitalized, I do, but I'm more focused on prevention, trying to avoid those events up front. And it can be very hard for people to really commit to controlling their risk factors. Because as I said earlier, these are silent conditions. You may not feel high blood pressure or high cholesterol or family history, but these are contributing to your events in the future. So I think my experience in my training told me that it's much better to prevent one of these events than to try to bring someone back from the brink. It's much better to prevent a heart attack than to have someone who now has to learn how to live as a heart attack survivor. So I think it's really made me focus in my cardiology practice right now and in my work at Hello Heart on prevention, trying to prevent these events from happening. The World Health Organization says that 80% of cardiovascular disease events are preventable if we did a better job managing risk factors like high blood pressure and high cholesterol. And that's how I try to approach my job, both at Hello Heart and in my job at White Plains Hospital.
And is there any other ways that you integrate technologies or therapies into traditional cardiology practice aside from Hello Heart?
Of course. I mean, you got to talk the talk if you're going to be a technology advocate. And I do. I treat tons of patients with high blood pressure. It's one of the most common diagnoses I treat. They might get referred to me because they've tried speaking with their primary care doctor and they didn't respond well to their first medication, maybe their second medication, maybe they had a side effect, maybe they have another condition like kidney disease. So, for members like that, I'm going to look at their blood pressure log. If they have a home device and they're keeping that blood pressure log, I want to see that data. It's so crucial to me because your blood pressure in the office may be different than your blood pressure at home. If they have a Apple Watch or another smart device with an EKG monitor, a lot of our devices have a single lead EKG and they're telling me that their heart is racing, I'm going to tell them, well, next time you have one of these episodes of palpitations, use your heart watch, record one of those strips and bring them to me. I'm very open to using technology, and I think it can definitely help my practice as a cardiologist. And the last thing I'll say about that is that focus on really controlling those risk factors aggressively and using all types of data that I can get my hands on. It's even more true for members who have had a heart attack or a stroke or have been diagnosed with something like congestive heart failure. Risk factor control for those survivors of those conditions, it's even more important because they are very high risk of having another one of those events, of course.
Now, Dr. Paz, we've heard a great deal about your professional side. So I'd like to wrap this up with some quick fire, lighthearted questions so we can just learn more a bit about you as a person. So the first question for you is, what were you afraid of as a child?
A lot of things. I think, obviously traditional things, spiders, snakes, and heights. But I think, fear of failure and, I was really driven to succeed by my family instilling kind of a hardworking motivation. So I think that was maybe the one less typical fear I had as a child.
Okay. And what is your favorite word in another language?
I love the word shalom. It's a Hebrew word that means hello, goodbye, and peace. It has a lot of different meanings, and I think it's a very special word.
Yeah. Like Paz, peace.
Yeah, my last name is Paz, which means peace in Spanish as well. So
yeah, I speak a bit of Spanish.
That's a very good analogy there.
Yeah. If you hadn't been a cardiologist, what would you have pursued in your life?
That's a great question. I've always been very interested in the sciences, in the life sciences. I think I would have had a career adjacent to medicine, maybe in health technology, maybe in healthcare consulting, trying to use the gifts of science and the advances of modern medicine at a population level. I think that, one of the reasons why I love the job that I have now is that I can practice one-on-one with a patient, and it's great to have an impact one-on-one. But in my work at Hello Heart, I'm having an impact at a population level. And I think there's lots of other entities, think of, CDC, FDA, lots of other entities where they use life sciences to try to improve health at a population level. And I imagine I may have ended up in one of those fields.
And finally, the floor is all yours. What should people take away from today's conversation?
Heart disease, depressed mood can feel really overwhelming. It feels like there's no way out. And I'm just here to tell people that there's lots of good tools you can use to help with both of these conditions. Obviously, look to your doctor to help, but family and friends, and again, try to get some of those small wins. Small wins, they have an amazing way of building on each other so that you accomplish small things on a daily basis. Day by day, you accomplish something small. And then at the end of that period, you've accomplished really quite a lot. So I think that's what I would say. Don't be demotivated. It's normal to feel overwhelmed, and there's lots of things you can do to really try to, address these issues piece by piece, day by day, rather than trying to tackle everything at once.
Absolutely. As we continue to address the complexities of modern healthcare, your expertise and perspectives are incredibly vital. Dr. Edo Paz, it's been a privilege having you with us on the DRH show, and I look forward to hearing more about your work. Thank you.
Thank you for having me on. The pleasure's been all mine.